services which the urban disadvantaged are availing in any event, whether it is schooling or private clinics, and that is true. I think what the panelists here were trying to suggest is that if governments or the entire country needs to take advantage of the fact that there is a larger population and increasingly growing population in urban areas, what is the responsibility of that country and how that country can best utilize this emerging situation. So I think we would all agree that there are private providers. I think Eileen's evaluation research has also shown that, and all of us have observed it in our work. So there is definitely that case, but governments also have a huge responsibility, and they are the ones who would eventually run the country or benefit economically or become an economic power over time.
I think the issue about keeping people in urban, in rural areas, I mean, we have to think about the reason why people migrate. It's because of opportunities. So I think if the opportunities are concentrated in urban areas, we'll always see people migrating. But I should also maybe demystify one fact that everybody, a lot of people tend to think about when we think about urban growth, the growth of the urban population. I think there's a tendency for people to think, oh, it's a migration. I think some people who have analyzed this have come to the conclusion that actually in sub-Saharan Africa, 60% of urban growth is due to natural increase in the urban areas. So it's the births that are there, because a lot of people in urban areas are still giving birth to more children than they want, even if total fertility rates are generally lower. So I think you have to deal with both places, and I think in terms of preventing urbanization, it's about opportunities. I think other countries, Joyce was just reminding me here that you look at Kenya. Kenya has devolved its governance system now and created 47 counties, 47 different governments. I think Nigeria is also a devolved system. I think these when you devolve development and you bring it closer to the people, that will likely create more opportunities for people to work in the rural areas. And also, I think one of the big problems we have in Africa is the low productivity of agriculture. So as more efforts are done to really address those issues, more people would rather live in the rural area than go and live in Kibera slum in Nairobi, which is really looks like a very, very nasty place to live in. So I think it has to be that balanced development approach. Thank you.
Joyce, would you like to answer the research question?
Okay. So I guess depending on who you speak to, the gaps will probably be different, not different, or will vary. But my opinion, one particular gap we're seeing from the work we've done is work on very young adolescents, especially in the slums. So we do have small-scale studies that have been done among adolescents, usually between 15 to 19 and 20 to 24, but very few studies have been done on the very young adolescents. And large-scale studies. So if you're looking in terms of research questions, which approaches or innovative approaches that will improve the well-being of very young adolescents in urban areas, we do know that they're initiating sex earlier than their counterparts in non-slum areas, even in the urban sector. But there's not enough research in that particular area. There's several studies that are doing it now. There's the Global Early Adolescence Study. There's that Adolescent Girls Initiative that's being implemented by the Population Council. But there's still not enough studies for very young adolescents in urban areas.
So I was getting a clarification on whether you were specifically interested in adolescents or more generally. Right. Okay. Just checking. My first answer is that there is actually a lot of information more recently from the urban reproductive health sites. So there's 4 countries: Kenya, Nigeria, Senegal, and Uttar Pradesh, India. We have a lot of information from those sites where we collected a lot of data, and the data are available to others if you'd like to examine it. There's longitudinal data, there's cross-sectional data as well from households and facilities. But so there are other existing data sources, including some of the demographic surveillance sites that exist around the world that have done a lot. What I would say is that we do lack broader information from other countries and other urban areas, including towns. We don't have good information on towns. And as you think about where people are going, I don't think we can keep them out of the urban areas, but maybe they'll start with towns. The growth of towns is important, and we need to be doing some research around these towns. And then I'll also say that we do lack some information, like qualitative information about what these urban populations really themselves, what they themselves think are their needs, and how to get them into, as you said, to the existing services. There are a lot of barriers to those. There are these existing private and public sector services, but there may be barriers to them getting there. It could be a language barrier because they've moved from a rural area and don't speak the language. It could be a cost barrier. It could be as I mentioned, for young people, it could be a barrier of being told you shouldn't be in this facility. So I think I answered a couple questions at the same time.
Ellie would like to take the same.
Yeah, I just wanted to note that apart from maybe the research gaps my colleagues have talked about, I think another critical gap is even application of the research that is already there in decision making. I think in the reproductive health arena, I think policymakers tend to just adopt policies or programs that somebody is ready to fund and so on. So you see a lot of governments saying let's do youth-friendly services. Or peer educators and so on. A lot of these approaches haven't really proven to be that effective, but a lot of money is going into them. So I think a lot of the research, as I said, I think policymakers are asking more questions on are really needing more implementation research. How do we address problems? And for those that are already there, I think we need better sort of ways of translating the evidence so that they understand what they can do in that context. So I think we need to broaden the concept of research really to include also the art of translating and promoting how this evidence gets used, especially on these non-high impact interventions already. If you see what is being done in many countries, there's very, very little reference to the actual evidence in determining what gets used.
Now that you mentioned that, I think the call for research actually from the IUSSP includes an element of that. I mean, that we want policy relevant research and for it to have an impact. So can I take another round of questions? Gentleman at the back.